Hello everyone, and welcome back to Psychology 36 with Professor Troy. This is video 3 about substance abuse and substance use disorders. I apologize for the high number of videos. There's a lot of material to cover, so I'm trying to get everything in. I wanted to go back for a second because when we ended the last video, I was talking about alcohol abuse. I moved on to cannabis use, but I wanted to talk about one thing that I forgot with alcohol use that's important to mention. One thing I didn't mention is the high rates of mortality over long-term alcohol use. I talked about Wernicke-Korsakoff's, but one other thing that's even more important than Wernicke-Korsakoff's is cirrhosis. Cirrhosis is damage to the liver that's done by long-term and excessive consumption of alcohol. And the problem with cirrhosis is that over time, there's the potential for cirrhosis to develop into cancer. And liver cancer obviously can be fatal like other cancers. So one of the bigger problems that people who have long-term alcohol abuse problems or struggles can potentially develop is cirrhosis. So I thought it was important to mention that. All right, going back to cannabis use. We talked a little bit about the effects of cannabis, but I'll go over that again. So the active ingredient in cannabis is THC, tetrahydrocannabinol. And the typical effects of cannabis use are going to be euphoria, heightened sensory experiences, a feeling of relaxation. Sometimes people develop lack of attention and sort of an unfamiliarity to their surroundings. One thing that I mentioned earlier, but it's worth mentioning again, is that research on cannabis is kind of coming in droves right now. Research on cannabis was limited before because there was only one lab that was authorized to do research on it, and they were only allowed to have small amounts of it. So the research was very, very limited. But now, there's a lot of places that are authorized to do research, and the amount of cannabis that they're actually allowed to have on hand is larger. So the amount of research that's coming in when it comes to cannabis benefits, drawbacks, etc., is sort of flooding the market, and we're sort of still parsing that out, figuring out what's accurate and what's not over time. Okay, so as I'm even giving you this information, in a week or two, it might be outdated. So just bear with me and be patient. If any updates come up, I'll certainly update you guys on that. Now, marijuana. Criteria for marijuana use disorder. Number one, it's taken in larger amounts than intended. This is sort of difficult to really justify because since it is considered an illegal drug outside of the prescription usage, it's difficult to argue what the intended use or the intended dose is. Is it one joint? Is it two joints? It's difficult to say, but excessive amounts are more than intended. Persistent desire or unsuccessful efforts to control marijuana use, cravings, etc. Going on to the next slide, important social or occupational recreational activities are given up. Marijuana is used in situations that can be dangerous, and then they develop tolerance and or withdrawal, which we talked about before. Now, if you look at these diagnostic criteria, and it's the same thing with alcohol, but if you look at these diagnostic criteria carefully, each one of them falls into one of two categories. And if we go back to the beginning of the semester, those two categories were an inability to function normally or significant distress. And if you look at these different diagnostic criteria, each one of them falls into one or both of those different criteria, right? An inability to function normally or causing significant distress. And in essence, that's when you know that substance use or substance abuse is a problem. If the use of the substance is impacting the individual's ability to function normally and or if it's causing significant distress, then it's a problem. And that's really what it comes down to. You can get into the minutia of the diagnosis here if you want to meet true diagnostic criteria, but if you're really worried that somebody that has a problem with drugs or alcohol, then the thing to pay attention to is their use causing an inability to function normally and or significant distress. Okay? Those are the things to keep in mind. Withdrawal symptoms from marijuana, they're pretty straightforward. I'm not going to go over all of them. Irritability, anger, nervousness, etc. You can take a look at these. Other withdrawal symptoms are here. One thing to remember, marijuana has some benefits, right? And the benefits of marijuana seem to be coming out every day. If you're on Facebook and you have friends with the right people or following the right Facebook pages, you'll see benefits of marijuana listed every day. New research shows that marijuana inhibits this or does that. The things that we know about marijuana are, or the benefits that we know of from marijuana so far that have been demonstrated time and time again is number one, pain reduction. Marijuana can be a very effective painkiller. Number two, marijuana can be an appetite stimulant. And number three, marijuana can reduce eye pressure, and I'll talk about why that's important in a second. But as a painkiller, it can be very, very effective. And the reason why this can be very good is for people with chronic pain conditions, chronic back problems. Lower back pain is one of the most common reasons to miss time at work. People with certain cancers can have pain associated with it. And, using marijuana in a regulated way might be able to limit the impacts that pain has on these individuals and might be able to help them function normally, actually. We talked about an appetite stimulant. So one of the big problems with cancer treatment is that people tend to get nauseous, they can lose their appetite, they can lose a lot of weight, and marijuana can help reduce the nausea and stimulate their appetite a little bit. Now, as far as eye pressure reduction goes, without getting into the physiology of this, your eyes have a normal eye pressure in them. As you get older, for some people, a good number of people, their eye pressure can increase. Increase in eye pressure, again, without going into all the physiological processes, can cause blindness. Increase in eye pressure for a long period of time, and that's called glaucoma. And glaucoma is the number one leading cause of blindness. Marijuana use or consumption of THC can actually reduce eye pressure, which can ultimately prevent or treat glaucoma effectively without a lot of side effects. So one of the big points of advocacy, or one of the big advocacy points of for the use of medical marijuana is to prevent blindness, because blindness obviously can be very debilitating. So people argue that marijuana can be extremely beneficial, and it tends to be one of, if not the most effective ways to reduce eye pressure. Okay. Now, continuing through the slides. Other long-term consequences of marijuana use, you can take a look at these. They're pretty straightforward. I'm not going to go over each one of them, but I want to go into heroin use right now. Heroin is an extremely popular drug right now. Okay, it's kind of flooding the streets, and there's a lot of heroin available for a number of different reasons. Not to get political, but right now, with sort of the upheaval and everything that's going on in Afghanistan, heroin and poppy seed farms are very, very popular. It's one of the few ways to actually make money. So it's still illegal, but it's one of the ways to actually make money. So there's a lot of poppy seed farms, and they ultimately end up producing heroin, and the heroin gets filtered to the United States eventually. And the availability is one of the things that leads to the potential for addiction. And there's a lot of heroin available, and it is cheap. One of the things about heroin is that the method of injection is usually intravenous. The method of ingestion, is usually intravenous. And we talked about the method of ingestion predicting physical dependence and abuse. Typically, what heroin users will tell you is the first time that they use it, they're hooked. Not for everybody, but for a lot of the people that try heroin. And because it's available and a lot of people are trying it, a lot of people are getting hooked, and it's dangerous. Heroin, originally was designed to be a painkiller, but it has other side effects to it. In high doses or overdose, it can cause respiratory suppression, meaning you stop breathing and you can suffocate. And again, heroin is extremely popular nowadays, and it can be quite dangerous. Okay. Now, one thing about heroin to understand, and the overdoses in heroin to understand that's important, is that a lot of heroin overdoses actually happen not because of how much heroin the person uses, but because of where they use it. If you think back to intro to psych and you're talking about classical conditioning and operant conditioning and things like that, basically what happens is that as you go through the prep process to use heroin, because there is a preparation process, you usually have to cook the heroin, put it into a syringe, bind your arm with a tourniquet to make the vein available, and then inject it into your arm. This is a process. As you're going through your process, your body is then conditioned to be physically prepared to use the heroin. This is after repeated attempts. You do this again and again, you go through the same process again and again, and all of a sudden, your body is prepared to take in the heroin. So it actually, being prepared to take the heroin can actually take higher doses of the heroin without it being as dangerous. What can happen is if you use heroin with different people, if you use heroin without doing the prep, if you use it at a different time, your body doesn't have the chance to prepare for the heroin. If it doesn't have the chance to prepare for the heroin, the same amount of heroin that you've always used can actually have greater impacts on you, and it can actually be much, much more dangerous than it normally is. And this is one of the reasons why people who use heroin frequently, and you would think that they can tolerate large amounts of heroin, will overdose sort of unexpectedly out of nowhere. Somebody could pass them a needle when they weren't ready for it. They could use it in a different place and time. And ultimately they can overdose, and it can be extremely dangerous. Okay, and that's how it relates to classical conditioning. Now, non-substance-based addictions. So the only non-substance-based addiction described in the DSM is gambling. This is new. This was added to the DSM-5. The reason why they added gambling to the DSM is new research has shown that there's sort of physiological effects to gambling, number one, and number two, behavioral studies have actually shown that gambling can significantly impact the person's ability to function normally, and it can cause distress. Okay, so we've added gambling in. They're talking about internet gaming being an addiction. They're talking about sex or exercise being an addiction also in the future. But right now the research is not there to support it. So the only one that's not substance-based is gambling. All right. Now, treatment of drug and alcohol use. I'll go through these as quickly as I can. The number one thing that you have to do when you talk about drug and alcohol use is ultimately getting the drug out of your system. When the drug is in your system, you're withdrawing. There's different ways to get the drug out of the system. Sometimes people just don't use drugs or alcohol at all, and they wait for it to come out. Sometimes they will take other medications at the same time. They'll do things to sort of calm their body down physically. So alcohol and benzos, which we haven't really talked about, but alcohol and benzos can be fatal when you're withdrawing. If you're heavily addicted or using it quite frequently or using large amounts, when you stop taking them, and they can induce seizures, and the seizures ultimately can be fatal over time. So one of the things that they might do when you're detoxing or getting the alcohol out of your system is give you a drug called Cerex. There's others, but they reduce seizures, theoretically. Okay. Aversive conditioning is another way to do it, where you pair the drug use with something unpleasant, and there's a couple of different ways to do this. Some people take a medication called antabuse, which basically makes you violently ill when you take in any alcohol. So you take the antabuse, you get sick, and then the thought is that you'll associate the antabuse with you'll associate the alcohol with getting sick, so you won't use it again. There's mixed results on this. One of the big things is that people that have alcohol use disorder will avoid taking the antabuse. And if they don't take the antabuse, they won't get sick. So if they know that they're going to want to drink, they stop taking the antabuse and they drink. For some people, it is effective. Attack therapy is a type of therapy where you will basically put a lot of pressure on the individual to face whatever fears they're avoiding through the use of alcohol and drugs. If not done correctly, obviously this can backfire. All right. Interventions, we talk about interventions. Intervention is a generic term for anything you do to try to change behavior, but the popularized term for interventions is now when a bunch of people tell you how much they care about you and how much the drug and alcohol use is impacting their lives. There's a video clip of interventions. I think it's from The Sopranos, actually, if I remember right. But it shows how a typical intervention is done. Obviously, the one in The Sopranos is not done professionally, but it gives you sort of an idea on how it's done, and some people find it effective. One of the more popular treatments is Alcoholics Anonymous. It's a group that's free. You go to Alcoholics Anonymous, and you have the ability to work with a sponsor, somebody that's been clean and sober for an extended period of time, and they become your support person. But it also gives you a support network. There's mixed results with Alcoholics Anonymous. I don't want to go through all the details of Alcoholics Anonymous. You can look it up online. It's very accessible. Some people love it and swear by it, but a number of people really don't see the benefits of it long term. But if it works, do it. Alcoholics Anonymous works on 12 steps, where you have to go through a number of steps, and that's part of your treatment and recovery process. And a couple of different beliefs. One is once an alcoholic, always an alcoholic, and always in recovery. Okay. Now, I talked about it not working for everybody, so I'll skip through that. Motivational interviewing is a big one, and this is probably the last thing that I'll talk about because the other things you can look through. Motivational interviewing is a newer technique, but it can be very, very effective, and it's being used for a lot of different disorders, not just substance abuse. In essence, motivational interviewing is a gentle way, and there's a good video link in these slides to take a look at that. It's a gentle way of creating what they call ambivalence. Most people who want to use drugs and alcohol want to continue using. This creates ambivalence. It creates a conflict, and then it allows the person to explore their own continued use. Okay, that's it for now.